panelists said the first step to fixing a problem is identifying it. At a town hall hosted by the Canadian Medical Association and Maclean's Magazine at Mohawk's McIntyre Theatre, Hamiltonians did just that.
How many times has anyone in your entire educational career, has anyone ever mentioned the words social determinants of health? When it's worth 65 or it has 65, 70% of our health outcome, you'd think that we should be talking about it possibly from grade 1.
The discussion was inspired by the Code Red series, which found that a person's life expectancy may be directly related to the socioeconomic status specific to where they grew up in Hamilton. The Code Red series, published in the Hamilton Spectator nearly 3 years ago, prompted major scrutiny of the public health and wellness system in Hamilton. Former Hamilton Family Health Services Director and current senior nursing consultant at Simon Fraser University, Debbie Sheehan, says variety will be one solution.
It can be totally overwhelming, and I think we need to kind of recognize that one solution is not going to fit everybody.
Mark Chamberlain is the president of Triveris Limited, a technologies commercialization firm. He thinks community support is going to play a more prominent role.
For various groups within our community, particularly at government levels, business levels, people who have either earned, voted in, or acclaimed positions of influence, of power, they have to start taking a role. And possibly one of the first parts of the role is to understand the impacts it has on their roles, on their businesses, on their communities, on their employees, if we don't do something.
For Dr. Anna Reid, president of the CMA, one major part of the problem is political.
I think one of our problems is that our political system is by definition short-sighted. And so there's not that leadership and vision to see beyond the next electoral cycle, to actually put money into something and actually get the payback.
Obstacles ranging from social and economic barriers to political processing were among the issues raised at the forum. Patients, doctors, nurses, social workers, and others expressed what they saw were holes in the current system.
People actually already know what the problems are, but it becomes very clear that the solution is one of needing political will, political leadership, a little bit of imagination, that as a society we actually need to examine our values. Why are we willing to let these inequities exist still?
Reporting from Mohawk College, I'm Neil Reyes.